Doctor, those discs that I'm looking at there, which I kind of call the little, like, jelly, if you will. I know it's not jelly, but it's like soft, right?
It is.
Does it degenerate over time when one gets older? Does it get thinner? Does that cause problems?
Sometimes.
Okay.
So all discs degenerate at some point, but not all degenerative discs cause pain. Now, as you mentioned, Olga, discs do degenerate in a very predictable manner. Discs become shorter and wider. Shorter contributes to our change in posture, and with time you could see our grandparents, for example, sort of move their heads forwards and move a little more pitched forwards. That's a problem related to disc degeneration. But it's the widening of the disc that frequently results in nerve irritation that is felt by patients down their legs or down their arms.
All right, and we have a couple of functions of these discs. Let's talk about these real quick, doctor, especially that last one, which is mobility in the spine. Let's go through the first one, shock absorption.
Absolutely. So discs, unlike bones, provide us with great shock absorption, and the gelatinous component, which is inside the disc, is the very cushion that gives us both height and gives us that spring ability as kids that diminishes with time. Discs do hold vertebrae together. In fact, 80% of spinal stability in the neck and 60% of the stability in the lower back comes from the discs. Finally, discs do provide mobility in the spine, but not at the expense of nerve compression. So imagine if a disc becomes wider and starts to irritate a nerve that causes this horrific pain to go down the shoulder and the arm. Those patients will frequently not want to move their head. That's your body's own response to protect the nerve, not allow it to have further injury. Now, we perceive these neck spasms as severe neck pain, and it's true to say that most of these spasms are muscular in nature. But the reality is that these spasms usually occur in conjunction to another process, which is usually a disc problem.
And that's why so important, motion and mobility for the health of the back, right?
Absolutely. Now, discs have to move.